Hey guys, this is Sandy White, the host of Simply Fit and your number one health and wellness cheerleader. And I'm super duper excited because we have Tsao Lin on again. And we're going to be talking about how to improve your health through holistic medicine. And she's been talking the whole segments that she's been on, bless her heart, about all things Chinese medicine. So I've got some basic questions that I think a lot of people fall into. So that's the category we're going to be going in. And I think this will help you guys to make a clear cut decision that this should be a part of your life. Before we jump into all of that, I do want to thank WYTV7 Community Broadcasters Network for allowing us to be on their platform again, guys, because we are on a mission to save 1 million lives. And the strategy that we go with is just giving you all simple tips and strategies on how you can implement different things in your life to improve your health, improve your nutrition, so you can overcome suicide and depression. And if they're not simple, they're not easy, and you can't implement them into your life on a regular basis, then you're going to be stuck. And we don't want you guys to be stuck. So for that, I want to thank WYTV7 because being on their platform, we can address a larger audience, and then you guys can go on the platform and not just see me, but you can see the other broadcasters that's on the platform, and you can pay it forward and you can bless somebody else's life. So with that being said, kudos to WYTV7. Please go check them out. And they also gave us the thumbs up, two thumbs ups, I should say, to give you guys a free 30-minute consultation so you can have a blueprint for your life, your health and wellness, so you can meet, exceed, and just constantly be consistent with your goals. So get online, sign up for that consultation before she takes it down, guys. So I told you guys, Tsao Lin Moy is going to be on here. She is an alternative Chinese medicine expert with over 20 years of experience in alternative and Chinese medicine, a licensed acupuncturist and herbalist. She has her facilities in New York City. She'll tell you guys more about that. And she also offers, she specializes in acupuncture, herbal medicine, energy healing, which I think is the bomb diggity bomb. And she treats her patients with this alternative procedures that, guys, I'm gonna tell you, for Black and brown communities, if you're afraid to go to the doctors, you need to, if you're in the New York area, please check out Tsao Lin or a licensed therapist, licensed acupuncturist, because you want your health to be on target. So before I talk a hole in my own head and suck up all the time, let's welcome Tsao Lin to the show. How are you today?
Very good. Thank you for having me on again.
I appreciate it. And guess what? You know what? I also wanted to start it off with you probably already know this. April is National Health Observance Month. So I'm not sure if you wear this, but most likely you are. But the audience, if you guys didn't know that. And I picked out a couple things that the awareness for, that they talk about a lot in April, because these are the things that Tsao Lin specializes in. She can, like April is alcohol awareness. She can help you with that. Foot therapy, reflexology, she can help you with that. IBS, which is irritable bowel syndrome, gut health, guess what? She can help you with that. And minority health, I just told you guys, Black and brown community statistics show that you guys do not go to the doctors for one reason or another. And I'm going to bring that up on why I said that again, because something just happened in my own family, which is sad. And then stress, guys, you cannot get around stress, but she's a master in helping you guys out. And so I said Black and brown communities again because 2 weeks, for 2 weeks straight, Tsao Lin, my brother was experiencing nausea and throwing up, and he worked through that. No one in his job told him, hey dude, something is wrong. He worked through it, and he was having many strokes. And then yesterday he had a full blown stroke, and the throwing up would not stop. And now his face, because it has so much fluid in it, you can't even see his eyes, nose, or mouth. he ended up with a broken spine or a fractured spine or something to the effect of that, which I think when that happened, it must have hit that blood vessel, and then it was a blood clot that went up the back of his neck, and the blood vessel split, and so now the blood is coming out right and left, and it's just horrible. Guys, you got to go to the doctor. Now I know, Jolyn, now I may be wrong, and I want you to jump in here and cut me
Sure.
off. If alternative with Chinese medicine can heal a blood vessel by certain things, let me know. If a person with a stroke needs to come in after the fact, let me know. I want to start off with that because, like I said, first of all, stuff like that should never happen, but it does because people won't go to the doctor. So I want to talk about general things that people can expect, because with regular medicine, Western medicine, like I said, for whatever reason, people are freaked out from going to the doctor. We don't want them freaked out with coming to you or any other licensed acupuncturist. So what are some general things that they can expect when they come into your facility, or someone that's quality like you are?
Oh, that's a good question. And first of all, I'm very sorry to hear about your brother. And the stroking and the vomiting is not particularly a common uh, uh, symptom. It can be very common if you've got, like a neck problem, especially around C3, C2, which, people have really bad migraines and they're vomiting a lot. Usually there's something going on there, inflammation. The his It sounds like he had a major it's like a vascular event, which unless he had had an MRI, they might not have picked it up, in terms of like having that. But there might have been other signs that were going on that what was happening wasn't okay, right? So it's hard to say that it would have been caught sooner. However, the like vomiting for 2 weeks and pushing through it, that's
That's
really
a
not
no no.
okay, like and so we see it like he must have had similar to like a migraine, something going on that was also causing like the throwing up, right? So he must have been suffering a lot with that. And I hope that they were able to, basically what they do is they do surgery in the back of the neck and kind of like do the draining and the relieve the pressure there. So post stroke, it really depends on the kind of stroke. Acupuncture is really like amazing for recovery. They usually do things like points in the scalp where they call them motor. These are like motor points that actually reflect other parts of the body. So scalp acupuncture is one of the things that you would do, because again, there is on the scalp, there is like a map of the body, or even like inside the ear, there are ear points that could be done, including one which is called brain stem. They can actually kind of like stimulate the nervous system. If So there are a lot of different things that can actually do to help. Um, and and at the same time, we need to look at what the underlying conditions were. Like, does a person have hypertension, high cholesterol, a lot of other things that need to be addressed, right? Because those are those little things that oftentimes we can ignore, and those are it's like that's the tip of the iceberg, that underneath there are other things that we're not paying attention to. And with Chinese medicine, the first thing is really you're helping people make that mind body connection, right? Not ignoring their body or pushing themselves. Yeah, you can push yourself once in a while, but our culture is such that we're always just like, oh, I can go on less sleep, or I don't need to eat this, or I can, I'll just keep working, or I'm pushing myself. Even when we have exercise and workouts, we have all this idea of being extreme, where we're fasting and colonics and I don't know, 90, whatever that is, X98, some of these workouts where people are throwing up because they're metabolizing their own muscles. And
Oh, that's gross.
well, yeah, that rhabdosis is, right? So people do these extreme things, but even if they're quote unquote healthy, the common denominator is kind of like ignoring our body, like, and not knowing, recognizing what's going on. And people, for a really long time before they even seek help from a physician, they usually are having symptoms for like a really long time. It could be like blood, like worse for men than women, blood in their urine or blood in their stool, like diarrhea, all that kind of stuff. They could have that going on for like years before they finally, may say like, oh, like I notice the toilet bowl is full of blood, or something, or they mention it and someone goes, oh my God, you got to go see the doctor, right? You have to go. So important is to learn about your body, like learn what works, like recognize that, like with sleep, it's not just the number of hours, it's also you want to wake up refreshed and feeling good. And if you don't feel rested, then we know that you're not getting a deep and restorative sleep, right? Or if you feel thirsty, you already dehydrated, like those kinds of things, to then, simple things that we don't need any money for, we need to, address ourselves, right? I hope I answered your question. If that
So, yes, and you actually jumped ahead without knowing you were jumping ahead,
Oh,
because I was
okay.
going to ask you a question, but that's okay. I'm going to ask you, because we have a few more minutes, and I'm just going to ask you something basic, and then
Sure.
we can take our commercial break. Actually, we could take our commercial break now and then come back, because one of the things, even if someone does not have a stroke, one of the things that you mentioned was the ear mapping, and I thought that was so interesting that I wanted to tap into that a little bit more, because you said that also deals with the brain stem. But regardless if you have a stroke, I think that'll help someone, period, in general.
Absolutely,
But
absolutely.
I think that has a little bit more to it, so we get into that when we come back from the break. But I want to ask you real quick: there are different styles of acupuncture: Chinese, tradition, American. What's the difference? Because I mean, I really thought they were mimicking one another. So, like, what's the big deal with all these different ones? Because we don't need to freak people out. And then, like, which one do you guys use? And I think we have about 3 minutes, so I don't want to cut you off if that's like too long. If it's a little long for you to explain, we
It's
can
a
take a
little
break.
it's a little long, but I can. Okay, so all of them recognize the acupuncture. We all agree the meridians. We all agree what the points are. The difference is going to be in the diagnostic and strategy, and like how someone might needle, like the energy, like the needling style, right? So like, imagine it's like cooking a dish, right? You could have all the same ingredients, but then how you're going to prepare it may be a little bit different to your taste, right? And so different styles have their techniques, which is how they approach a situation. They all will recognize a lot of the basic tenets of it, and it's just, you start to look at where the history is, where it was developed, what is the cultural significance that influences, right, that'll influence. For instance, in the more north of China, it's much colder. So what you'll see are the approach is really about looking for where cold might be in the body. And
Okay.
where people are, further south, they have more febrile diseases, and they look at most conditions are one of coming from heat, like some kind of exposure. Now, if you have a cold in the north, you're still going to have a fever, right?
Right.
But you look at, how they would address the treatment is also based on, where they are in the environment, right?
Okay.
So
So
multiple, yeah.
so it's not one is better than the other. It's them adapting to the environment where their patients are.
Right. Now, I actually practice several different styles because, people, not everyone is the same.
Right.
That I mean, but I do have a set of where I start. And then I look at, where is the pattern and what might be more appropriate for someone, how they're responding, right?
Okay.
They may,
That
yeah.
that makes sense. Okay, guys, we're gonna take a quick commercial break, and then when we come back, Cholin is gonna talk to us about ear mapping and the benefits of using ear mapping. And I think if I'm correct, if I'm incorrect, to chime in, this might be a really good start once when somebody says, "I want to introduce alternative medicine." This might be a good start where they're not. Uncomfortable or scared like they would go into a regular Western doctor. Is that a good analogy?
Yeah,
Okay.
I think, yeah, this is a great way, and we can talk about it after,
Okay.
yeah, we could talk about it after for sure. It's not going to hurt them. They're not going to damage themselves, right? So,
Cool. Okay, guys. So we'll take a quick commercial break, and then we're going to come back and share with you guys about ear mapping. All right. See you in a bit. You're invited to the Smart Strategies for a Slim Body Masterclass hosted by Integrative Healing Arts and Simply Fit. Throughout the demonstrated masterclass, you'll learn healthy habits that will slim you down, like making time for exercise and finding a quiet place for meditating. Throughout the masterclass, you'll learn about acupuncture and sleep, as well as balanced meals and responsible snacking. For more information about the May 21st masterclass, just click the registration link that you see on the screen. Hey guys, we're back with a second half of Simply Fit. I'm your host, Sandy White, and we've been talking with Tsao Lin Moy about how to improve your health and wellness through holistic medicine. And also, before we jump into our second half about ear mapping, I do want you guys to save the date for May the 21st. Our master class will be Smart Strategies for a Slim, Healthy Body with Tsao Lin Moy and myself. If you want to know more information, just go to my landing page, Simply Fit, and you can find out more information about the masterclass. All right, guys, so let's jump back into a quick, simple way. I don't want to say simple, but a non invasive way to start introducing alternative medicine, and that's with ear mapping. And I know there's you talked about three things that when you do the acupuncture, it will stimulate the brain or brain stem. And I'm going to let you like chime in because I don't want to say these points and things wrong. But just a way to get somebody gradually introduced to, and then like what is ear mapping? What does it consist of? And then like how long are the sessions and what like do they need to come one time and they're healed or do they need to come multiple times? And I know that might not be an easy answer because everybody's different.
okay, great question. Okay, so one of the ear, well, like we call it ear acupuncture. And what that is that we look at the ear is actually a microcosm or like a map, like like just like reflexology. You have reflexology on the feet. You have reflexology on the hands and reflexology in the ear. So our body has many areas that are reflections of our entire body and internal organs. So if you imagine at one time we were like all, almost like a flower, all kind of crumpled inside, right? And then you start to look as we opened up, and these are like how the meridians then stretch out, and you kind of wonder, well, wait a second, if this is on this side, how does that have anything to do with this part of the body? You have to remember at one point we were all just kind of like, folded up and everything was touching. So you can find, that's a lot of where like the different meridians and the points are, where you find like how they relate, and they do relate back to the brain. You can actually see the brain lights up with certain points. With the what we call ear mapping, or the map of the, in the ear, it'll have the different organs that are represented there, including like the spine, the limbs, the internal organs. And one of the points that I mentioned was something called like brain point or brain stem, and that is a reflection of the nervous system, right? One part of the nervous system. And when I work with somebody who has, let's say, like difficulty focusing, or there's something that's neurological, I would, choose, that would be one of the points that I would choose, because I know that it's tapping into the nervous system, meaning like brain stem, right? That they it's like it helps to reset. Since we can't do actual brain surgery, we need to look at different points that are going to reflect back, right? And actually, our skin is the largest part of our nervous system, right? It's a sensory organ. So very, if you want to, stimulate the brain, having like touch, right? Which is why massage is great. Which is why we need, to be hugged, right? Which is why pets are very good for our mental health, right? Because we have the tactile stimulation, right?
So,
So, mhm.
no, no, no. Go ahead. Go ahead.
No, so if somebody was, oh, and okay, so like ear acupuncture, what they do is very easy to administer. They use it a lot for post-traumatic stress disorder. They use it in the battlefield acupuncture, with soldiers that have PTSD. They use it for addiction, because it releases a lot of endorphins that will interfere with the cravings, and also those feel good chemicals that also help with pain. Right? So this is one, and also there are points there for weight loss, because they also help with, food cravings too. Right? So that's an easy way to experience acupuncture, is like with certain ear points, or if you're afraid of needles, you could use little seeds that are available. So and those are, very safe, easy to use.
Now these seeds, they, because I don't want anybody thinking they can go buy this. They're not doing it themselves. They need to go into an office with a licensed acupuncturist, and then when you guys do your initial assessment, you'll determine at that time, if the person is afraid of needles, and I won't do the needles, I'll do the seeds. That's not, they're not going, this person is not going to buy their own seeds, right? I don't want them thinking that this is just different alternatives to get the same result in your office, or another acupuncturist that's
Yeah, I mean, there are, okay, so in a lot of like community clinics, they'll do, where they have people, seated, like a lot of the clinics that are dealing with addiction and with PTSD, they'll do basically ear acupuncture, because it's very easy, it's very quick. Someone can be lying in a recliner and doing, certain points for like relaxation, or they have certain protocols, very specific. If you go to a licensed acupuncturist, they can actually they would put ear points in as well, and full body points too. Or after you have your full on session, they could then maybe put little seeds on those points, and they're attached with like an adhesive. I mean, it's better. I don't say better. You should go to see a practitioner, and they will, so you get accuracy. I know that all on TikTok and Facebook, and everyone is like doing all kinds of things. Uh, People that have no experience are teaching other people, this is how you do it. But the thing is that it's like not a good thing for people to just like go off and do
Yeah,
it, right?
I
So
kind of look at that as you let your girlfriend take a potato and burn the needle that your mama uses to sew up your clothes and give you, holes in the ears so you can wear earrings. That doesn't make sense, but people do it. That's pretty much what we're saying. You go to a licensed therapist, so it's done correctly. There's no, you're not hitting the wrong, I don't want to say meridian points, but you're just not hitting the wrong acupuncture points. What I want to ask, how long is the session? How often would the person need to come back? And you pointed to a couple things that the ear mapping acupuncture is good for. How would you know if, like you said, somebody that needed focus, um, or all of these just byproducts? Was if someone needed focus but they didn't need to lose weight, how do you know how to maneuver the needles? Because
well,
somebody,
it's very autoregulatory. Your body is autoregulatory, and
oh,
so that's the doing. I don't know anybody who says they don't need to lose weight.
no, I said
They'll
that
be
because
like, they'll be like, bring it on.
no, I said that because you mentioned focus, and my
Yeah, I
little
opened to
one
focus.
needs
Yeah, there's
help with.
certain points for focus that
Yeah,
I
because
would.
my little one needs help with focus. So I
Oh,
was
okay.
so I'm like, I don't need my baby losing weight. He already small. So that's why I was like, how does it work if you don't need to lose weight but you need focus?
So I wouldn't worry about, that your so with something like weight loss, what it does is that your body works efficiently, right? So
Ah,
people who are struggling to lose weight, that we know metabolically that their body is off balance. And so, depending on what they're presenting with, you choose points to help their body go back into balance. And when someone is in balance, their body works very efficiently.
so it's a
Uh,
reset.
it's always a reset. Yeah, we're always looking at, you got
Awesome.
to balance first and then you can heal, right? So people are like, oh, I need to heal about, like, actually, you need to bring your body into balance, into a place of like where you're like, okay, you have stability, and then everything can align itself and then it functions, right? Kind of
God
like
knew
the
what he
wheels
was
on the
doing.
cart.
God
Yeah.
knew what he was doing. That is so awesome. And I'm glad you said that because I'm like, you're showing all these different benefits. How do you know? Let's point here so you don't lose weight. Let's point here so mess with you. You're like, no, 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 no. It's because when you point, your body already knows where I need to be focused and balanced. That is so incredible. I love that.
Yeah. And
So,
also, I mean, for weight loss, there's certain point combinations that you're looking at certain point combinations. So if somebody doesn't need to, if you were to do that and someone doesn't, let's say, need to lose weight, their body would just be like, okay.
I don't need to lose weight, but
Like it's not going to,
it's not
yeah.
gonna do it. Oh, that's so awesome. How long would a person need to come in, um, or you would know based off of the assessment, like, okay, I'm brand new and I'm a little scared, so can we start with the ear, and then you would maybe suggest to them, hey, let's move on to this because this will get you better results, or can they stick with ear mapping and come in a couple sessions?
They could stick with the ear mapping, but I mean, with a session, it's more than just the needles, right? We're looking at the needles are like a part of the treatment, but the rest of it is also, addressing and reflecting back what's going on with their life. Like, what are they going to do with, their food, they're changing their habits, like all of those things. So really, like the ear is like doing those points are a way to kind of help to create like more stability so that then they can actually move forward. So as you know, when someone's like, okay, I'm gonna do this, I'm gonna go and lose weight, I'm gonna eat food, I'm gonna like all of those things, if they're kind of off, then they actually it becomes much more disruptive. And so really like looking at how can like I help, or how would the medicine help that person to be in a place of stability, or we call like balance, and then they're able to actually do those other things. right? Otherwise, we just become more tired and wired and then give up, right? That's like you see people give up with
I love your personality. I love how you explain stuff. So, guys, if you have been uncomfortable going to Western medicine, I'm telling you, this is a great alternative to add into your life and get yourself back on track. We have been talking with Tsao Lin Moy. We have about 2 or 3 minutes left, and I want you, Tsao Lin, to tell them how they can reach you and the best times or your calendar or whatever that they can maybe do a consultation or something so they can get started.
Absolutely. Well, if you go to my Instagram, which is Integrative Healing Arts NYC, that there is a link tree, and there I can offer it's a what we call a discovery call. You can also text me. There's like a way of contacting me, and we can, have a conversation, right? Then the other thing too is, we're going to be doing this master class, which I know is going to be, you know, full of information that, sign up for it as soon as it gets posted on Sandy's landing page. And of course, you'll have the opportunity to ask more questions, and we can get you started with like a blueprint for, taking certain steps that can get you on your way. And what I do want to say is that Western medicine has a limitation, and at the same time, you as a person, you get to pick who you want to work with. So not all Western medicine is bad, right? Because it's very life saving. It's
Right.
really a matter of, if your doctor says stuff, and we know they gaslight all the time, they tell you that, you're making it up, is not possible for you to have stuff. Um, Again, that mind body connection, if there's something wrong, and then you need to take action with it, right? and
Right.
and and that's what's really important. And create a team, develop that relationship with a practitioner. Ask around, who do you, if you know somebody, do you like them? I always ask, like, oh, do you like your doctor? Who's your doctor? Give me their
Right.
name, I'll refer people. I'm always looking for someone by recommendation, because in this day and age, having an actual person to listen to you and care about you, which is really like the basis of Chinese medicine, is that relationship. It's very hard to find.
Right.
And don't give up, even with
Right.
Western medicine, right?
All right, guys, we have been talking with Tsao Lin Moy, and we've been talking about all things Chinese medicine so that you can improve your health and wellness. I appreciate that. And as she mentioned, don't forget, save the date for the master class. It's coming up on the 21st of May. And go to the landing page for Simply Fit so you can get more information. So you'll know when the class is actually going to be opening, starting allowing you guys to sign up. But we appreciate you guys coming on tonight. Make sure you check your time zone, because we do broadcast every Wednesday night at 7 p.m. Eastern Standard Time on WYTV7 Community Broadcasters Network. Until next week, thank you, Tsao Lin, and we will see
Thank
you
you.
guys next week.